These are vector-borne reportable diseases in Ontario. Lyme disease is caused by a bacteria called Borrelia burgdorferi, which is a zoonotic tick-borne disease. Some symptoms of Lyme disease. Lyme disease presents itself in 3 different stages. The first one being the early localized stage, leading to early disseminated disease, and stage 3 would be the late disease. Stage 1, or early localized disease, presents itself as erythema migrans, or bullseye rashes at the site of the tick bite, along with fever, malaise, headache, neck stiffness, and fatigue. The early disseminated disease presents itself with multiple bullseye rashes, occurs weeks after tick bite, also with lazy eye, swollen limbs, conjunctivitis or pink eye, headache, fatigue, and carditis, which is heart block. Late disease is described as recurring arthritis. It can develop if early infection is not detected or treated. It can lead to meningitis, behavioral changes, sleep disturbances, and fatigue. Transmission of Lyme disease is from an infected tick that has been attached for 24 to 36 hours. The amount of time bacteria migrates from the gut to the salivary gland in the tick, that's 24 to 36 hours. It can also be transmitted theoretically through blood transfusions. However, hasn't been observed. Incubation period of Lyme disease is 3 to 30 days from the formation of the rash. Reservoir for Lyme disease are deers and small mammals that can spread Borrelia burgdorferi to ticks, specifically white-footed mice. The tick specifically responsible for transmitting to humans is the black-legged tick, or Ixodes scapularis. These ticks bite humans and spread it to humans. Black-legged ticks are infected at a larval or nymph stage and are infective for the rest of their life. People at risk of infection are, reinfection can happen after treatment of antibiotics. A confirmed case is someone with a EM rash, or bullseye rash, that is larger than 5 centimeters in diameter and live in a Lyme disease endemic area. Also, lab confirmation of Lyme disease. Some case management work we need to do is to see if the case has traveled to an area in the past month that has a lot of black-legged ticks. Do they do work outside, or are they outdoorsy? When did the rash occur, and when was the tick bite? Some preventive measures are education, to wear closed-toe shoes, long sleeves and pants, tuck pants into socks, use DEET, avoid tick areas like tall grasses, and remove ticks from pets. Anaplasmosis is caused by a bacteria called Anaplasma phagocytophilium, and it causes human granulitic anaplasmosis, or just anaplasmosis. It's a tick-borne disease, and it presents itself with symptoms of fever followed with headache, malaise, and anemia. It can begin to show 1 to 2 weeks after a black-legged tick bite. Other symptoms include abdominal pain, nausea, vomiting, diarrhea, loss of appetite, rash, respiratory symptoms, and central nervous system symptoms. It can usually last 1 to 2 weeks if untreated. Complications include respiratory failure, bleeding problems, organ failure, and death. Transmission, it's usually transmitted from infected tick bites, but can also spread through blood transfusions, organ transplants, direct contact with infected blood, inhalation of aerosolized infected carcasses, and through childbirth. Incubation period is 5 to 21 days from exposure, but usually 1 to 2 weeks. Reservoirs include deer, sheep, cattle, goats, or small mammals. Again, these ticks can get the bacteria from these animals and spread it to humans. Again, ticks can get infected in the larval, nymph, or adult stage and spread it to us. People at risk are people who live in and work in areas with high tick prevalence. The case definition is lab confirmation with or without symptoms. A probable case is lab evidence and symptoms, but non-confirmation. Some case management work to ask are travel to tick endemic areas in the past month, their occupation / outdoor activities, symptom of onset, date of onset, blood transfusions, and date of any tick bites. Again, preventative measures for ticks are to wear light-colored clothing, long sleeves, pants tucked into socks, avoiding tall grasses and leaf litters, checking for ticks, and examining our gear and pets. Babesiosis is caused by a protozoan parasite in the Babesia genus. Over 100 Babesia species are available, but Babesia microti is the most common in North America, and babesiosis is presented with symptoms of fever, chills, intense sweats, headache, dark urine, and jaundice. However, most infections are asymptomatic. Babesiosis can lead to low blood pressure, disseminated intravascular coagulation, organ failure, and death. Transmission is in tick bites and blood transfusions. Incubation period for tick bites are 1 to 4 weeks, whereas blood transfusions are 1 to 9 weeks. Period of communicability. People can be infected via blood transfusions or blood transplants. That's how it can spread from people. Reservoir are usually small mammals, such as the white-footed mouse and black-legged ticks. People at high risk are people with underlying conditions such as chronic liver failure, or not liver failure, but liver disease, and elderly. Confirmed cases are lab confirmation with or without symptoms, whereas a probable case is signs and symptoms with lab evidence. Epidemiological links to blood transfusions or organ transplants, or neonates from mother with babesiosis. So meaning a pregnant mother can transmit babesiosis to a baby. Case management. Has the person traveled to any tick endemic areas? Again, same sort of questions you ask for the past few ones, and same sort of preventative measures for any tick-borne diseases. The next disease is tularemia. It's also known as rabbit fever and is caused by the bacteria Francisella tularensis, which is a gram-negative bacteria, and it is also a potential bioterrorism agent. It presents itself as a sudden and abrupt high fever with chills, fatigue, nausea, and headaches, and it can lead to hepatitis, endocarditis, or meningitis. It can be transmitted in a number of ways, through tick bites, fly bites, handling infected animal tissue, ingestion of contaminated food or water, specifically rabbit meat, inhalation of aerosols, for example, hay from lawn mowing. Incubation period is 3 to 5 days. However, it can be as long as 1 to 4 days. And person-to-person transmission is rare, but it can be found in blood in the first 2 weeks. Flies can spread via bites for 2 weeks. Ticks can spread throughout their life. Frozen rabbit meat can be infected for more than 3 years. Reservoir for tularemia are wild animals such as rabbits and voles, and ticks such as the American dog tick, Lone Star tick, Rocky Mountain ticks, and wood ticks. Confirmed cases are signs and symptoms with isolation of Francisella tularensis, as well as contact management include asking about any animal contacts, such as contact with muskrats and rabbits, history of tick, fly, or mosquito bites, and it's important to note that it can be used as a bioterrorism agent and requires the activation of Provincial Emergency Operations Center. Also, if there's signs of sabotage, you should call the police. Preventative measures include educating about tick, fly, and mosquito bites, and wearing long sleeves, DEET, avoiding tick areas, avoiding untreated waters, and it's also important to educate hunters and trappers as they are at risk of contracting tularemia. We should educate them on how to handle wildlife effectively and provide education about cooking wild game, especially rabbits. Powassan virus infection is caused by the Powassan virus, or POWV. It is an RNA virus, part of the flavivirus genus, and it is similar to yellow fever and West Nile virus. There are two types of POWV, lineage 1, which is prototype POWV, and lineage 2, which is the deer tick virus, DTV. Symptoms of Powassan virus include fever, chills, headache, nausea, vomiting, and confusion. Most infections are asymptomatic, and it can usually manifest itself in phases. The first phase would be the symptoms such as fever, chills, headache, nausea, and vomiting, and then a phase of remission, followed by a febrile phase or acute high fever, and the last phase would be neurological degradation. Again, Powassan virus can lead to meningitis, encephalitis, confusion, loss of coordination, paralysis, seizures, or comas. It can also lead to long-term health problems such as recurring headaches, muscle loss, and memory loss. Transmission is usually through infected tick bites, and the bite can be as long as 15 minutes for the virus to be transmitted. Incubation period is 1 week to 1 month after a tick bite, and communicability is through blood transfusions of infected people. Reservoirs include the white-footed mouse, tick vectors such as black-legged ticks, groundhog ticks, which is called Ixodes cooki, squirrel ticks, which are Ixodes marxi. Confirmed cases are signs and symptoms with lab confirmation. Probable cases are signs and symptoms with lab evidence of infection. Case management are to ask for history of travel to endemic areas for ticks, occupation or outdoor activities, date of tick bite, and date of onset of symptoms. Psittacosis or ornithosis. It's caused by a bacteria called Chlamydia psittaci, which is the same genus as the bacteria that causes the sexually transmitted infection, chlamydia. Psittacosis or ornithosis presents itself as mild forms of common respiratory illness, but with sudden onset of fever, along with chills, sweating, and respiratory tract infections. These coughs are usually non-productive, and this illness can usually be mild or go undiagnosed. It can lead to encephalitis, and transmission is through inhalation of dried feces or nasal secretions from infected birds, handling dust from feathers of infected birds, and person-to-person transmission is rare. Incubation period is 1 to 4 weeks. The period of communicability, so birds can shed intermittently and continuously for weeks or months. So reservoirs, the main reservoirs are wild and domestic birds, specifically birds from the Cicatine genus, birds such as parakeets, parrots, and lovebirds. Less often, poultry, pigeons, and seabirds can transmit psittacosis. Healthy birds can be carriers when they are stressed. They start to shed. Stress can be from overcrowding or shipping conditions. People at high risk are older adults. They can get severe infections. Confirmed cases are signs and symptoms and isolation of chlamydia psittaci. Probable cases are signs and symptoms with an epilink to a known source, such as a bird. Some case management questions to ask are history of exposure to birds, such as parrots or any other caged birds, exposure to poultry farms. We also want to know if, isolation is not really required if proper hand hygiene and coughing etiquette is followed. If the source is from a bird, you must contact the CFIA or OMAFRA to help with the investigation. Infected birds should be quarantined. Prevention includes education about risks of exposure from occupations or risk of exposure from pests. Cleaning, cage cleaning and feeding in ways that minimize the circulation of dusts or feathers or droppings. Wearing PPE while handling cages and bird feeders. Treating pets when they're ill, and disinfecting contaminated premises. West Nile virus illness. So it's caused by the West Nile virus, which is an RNA virus in the flavivirus genus. Again, this is the same genus as Powassan virus. Some symptoms of West Nile virus. West Nile virus has three main clinical manifestations. It can either be asymptomatic, it could be West Nile virus neurological syndrome, or West Nile virus non-neurological syndrome. So West Nile virus neurological syndrome manifests itself as fever, encephalitis, viral meningitis. It can lead to flaccid paralysis, movement disorders, and Parkinson's-like conditions, as well as other neurological symptoms. West Nile virus non-neurological syndrome presents itself as a mild flu-like illness, fever, myalgia, headache, fatigue, and rashes. Again, complications of West Nile virus are flaccid paralysis, meningitis, encephalitis, and Parkinson's. Transmission. So in Ontario, West Nile virus can be transmitted via Culex mosquitoes. The Culex mosquitoes in question are Culex pippins and Culex restans. Person-to-person transmission can occur via blood transfusions, and vertical transmission can also occur through human milk, but is uncommon. Incubation period is about 2 to 14 days, but usually 2 to 6 days. Reservoirs are corvidae birds such as blue jays, crows, and ravens. So Culex mosquitoes will feed on these infected birds, and then once they feed, they can transmit the disease, West Nile virus, to humans and other mammals. The virus cannot accumulate enough in human blood to make humans hosts. Humans are dead-end hosts for West Nile virus. People at high risk are people with underlying conditions tend to have more severe infections, and people who do activities that can result in increased exposure to mosquitoes. So case definitions are signs and symptoms with neurological symptoms for West Nile neurological syndrome, and a culture of West Nile virus and antibodies. For non-neurological symptoms, symptoms that are flu-like with a positive West Nile virus culture. Asymptomatic cases are just through lab confirmation. Some case management. If there has been a history of organ donations, we must contact Trillium gift of life. Again, West Nile virus can be transmitted through organ transplants. Some prevention includes repellent with DEET, wearing long sleeves and long pants that are light in color, and cleaning up mosquito breeding areas such as standing water. Rabies, the illness, is caused by the rabies virus, which is an RNA virus, part of the Rhabdoviridae family, which is part of the Lyssavirus family, genus. Rabies presents itself as multiple phases of illness. Symptoms don't start until the virus reaches the spinal cord, and that's when the initial stage begins, which is followed by an excitation phase, and lastly, an acute neurological phase. In the initial phase, cases can experience anxiety, an elevated body temperature, indefinite sensory alterations around the lesion or the site of the bite, and malaise. Excitation phase presents itself as diluted pupils, increased salivation, hypersensitivity to touch, and hydrophobia. The acute neurological phase presents itself as difficulty swallowing, respiratory spasms, generalized convulsions, and death. The acute neurological phase always progresses to death. Complications include acute encephalomyelitis that always progresses to coma and death within 10 days of the first symptom. Transmission is primarily rabies is primarily a disease of animals, but can be transmitted to humans via saliva of infected animals through bites or scratches. Specifically when skin breaks, saliva is in contact with mucosal membranes. Person-to-person transmission is rare, and airborne spread is possible in caves or lab settings. Transmission via organ transplants is also possible if the donor is undiagnosed. The incubation period is usually 3 to 8 weeks. It can be several days or several years, depending on the severity of the wound, location of the wound in relation to nerve supply, and distance from the brain. If it also depends on protection from clothing and adequate washing of wound cleansing. Period of communicability. Rabid animals are only infectious from the time the virus reaches their salivary glands until death. Death occurs 1 week from the onset of symptoms in reservoir animals. Different species can shed for different lengths of time. Cats, dogs, and ferrets can shed for 10 days before the onset of symptoms. Other mammals can shed for 14 days before the onset of symptoms. Reservoir. Rabies is a disease of mammals in Canada and in the US. Main reservoirs include skunks, foxes, raccoons, and bats. In Canada, the canine variant has been eliminated. So confirmed cases are signs and symptoms in either viral detection in specimens, isolation of rabies in saliva, and RNA detection in saliva. Case management. So it's important to determine the possible source, including animals involved, determine if anyone else exposed to the animal source, the type of exposure, was it a provoked bite or scratch, the geographical location of the exposure, determine the immunization status of the animal, if the disease is imported or domesticated from domesticated animals, contact OMAFRA. Death is imminent if symptoms are present. We should also do animal confinement for 10 days for domestic animals and animal confinement for livestock for 14 days to determine if transmission has happened to the human after a bite. If so, post-exposure prophylaxis is recommended, along with rabies vaccination. Some prevention are to avoid contact with wild animals acting strangely or ill, promoting rabies immunization in cats and dogs, reporting aggressive animals that have bitten people to the health unit, Pre-exposure vaccinations should be given to people at high risk of exposure, people such as veterinarians, wildlife and park personnel, and people traveling to rabies endemic areas. We should also avoid capturing bats, bat-proofing homes, wash animal bites and wounds immediately with soap and clean running water, seek medical attention immediately, and avoid contact with infected saliva. Hantavirus pulmonary syndrome is caused by the Sin nombre virus, SNV. It is part of the Bunnyviridae virus, and it is there are also other viruses associated with hantavirus pulmonary syndrome, but Sin nombre virus is the main one. Other viruses include the Bayou virus, Black Canal virus, New York virus, and monogliae virus. Symptoms of Hanta pulmonary virus include flu-like symptoms with fever, headache, dizziness, nausea, and other GI symptoms, followed by cough and a deterioration of lung function. Low-grade fever that requires supplemental oxygen is a sign of hantavirus. Accumulation of substances in lungs, sudden hospitalization after 72 hours, and unexplained illness resulting in death are signs of hantavirus. Again, the complications are deterioration of pulmonary function. The transmission of hantavirus is primarily through infected rodents, which can shed through their saliva, feces, and urine. Most of the virus is in their lungs. Transmission primarily occurs to the inhalation of aerosolized virus from infected saliva, urine, and feces. Can be transmitted via bites, contact mucous membranes, and non-intact skin. Airborne, it can be airborne in poorly ventilated homes, vehicles, buildings with visible rodent infestations. Incubation is not really defined, but it's usually 2 weeks from exposure. The period of communicability, it's important to note that no person-to-person transmission is observed. However, nosocomial infections have been documented in South America. The reservoir for hantavirus usually are deer mice in rural and semi-rural areas, often in old barns or old buildings. Signs show pack rats and chipmunks may have it too. So some case management work we can ask are history of exposure, travel history, occupational exposure. Do they handle rodents? Outbreak management. One case is considered an outbreak, and it's important to focus on rodent control, educating about avoiding rodents and pest management, surveillance of wild rodents, and for hantavirus infections. Some preventions include rodent control in homes. It's important to eliminate food sources in homes, store food in a way that protects it from rodents, limiting nesting sites, limiting holes in walls or possible entrances, snap traps, and rodenticides. It's important when cleaning, do not sweep or vacuum as it can aerosolize the virus. Contaminated areas should be cleaned using a wet mop or wet towel with disinfectant, and then disinfecting the contaminated areas. While doing this, we should be wearing PPE to avoid inhaling dust by using respirators. Avoid wild rodents and direct contact. Plague. Plague is caused by the bacteria called Yersinia pestis, which is a gram-negative bacteria. If aerosolized, plague can be a potential bioterrorism agent. Symptoms include fever, chills, headache, malaise, and it can present itself as 3 different illnesses: bubonic plague, systemic plague, or pneumonic plague. Bubonic plague is the most common form. It's spread from the bite of infected fleas from rodents. Presents itself as buboes or abscesses at the site of flea bite, swollen lymph nodes that can turn black when they burst. It's called the Black Death because tissue is often blackened by gangrene. Systemic plague. So all forms of plague can progress into systemic plague. It's basically a blood infection of Yersinia pestis. Pneumonic plague happens when lungs become infected and can result in pneumonia, and it can spread person to person. Complications are death if it's untreated. Transmission. Bubonic plague is transmitted by infected fleas or handling tissue from infected animals. Pneumonic plague is transmitted by inhalation or contact of droplets from an infected person. It's important to note that cats can transmit through bites, scratches, and respiratory droplets. Cats can develop abscesses and are a source of infection for veterinary personnel. Incubation period is 1 to 7 days. The period of communicability. Bubonic plague, person-to-person transmission occurs when the buboes or abscesses burst and contact is made with the pus. Pneumonic plague is highly communicable under conditions of overcrowding or cool temperatures. Fleas can be infective for months. Reservoirs. Wild rodents such as ground squirrels, rats, and mice are reservoirs. Fleas feed on them and become infected and then spread to humans. Rabbits, hares, cats can become infected and infect people too. Confirmed case is the isolation of Yersinia pestis. Case management. Every case should be followed up immediately to eliminate potential for bioterrorism. Case investigation should be done in consultation with the Ministry, Public Health Ontario Labs, and Public Health Agency of Canada. Some information to collect are travel history, exposure to fleas, wild carnivores, and domestic cats. Their occupation, are they vets, or are they trappers? Exposure to other potential cases. Again, if bioterrorism is suspected, we should activate the Provincial Emergency Operations Center, and if sabotage is suspected, the police should be contacted. Contact management. People living with someone who has pneumonic plague must get antibiotics, must be placed under surveillance for 7 days, and isolated. People in direct contact with pus of someone with the bubonic plague must get antibiotics. They should also be isolated and surveilled for 7 days. Prevention. Avoid exposure to fleas. Use insect repellents. Control fleas on pets. Use gloves when handling wildlife. Vets should wear PPE while handling sick cats, and droplet precautions should be followed. Echinococcus multiochlorarius infection is caused by the ingestion of Echinococcus multiochlorarius, which is a tapeworm. When we ingest the eggs, we can get infected by this tapeworm. Once ingested, the eggs can develop into larvae, which can grow into budding cysts. Symptoms. It's usually asymptomatic in the first 5 to 15 years, which is the incubation period. During the larval stage, after consuming these eggs, a destructive disease is caused called alveolar echinococcus. It could also lead to lesions in the liver. It can produce tumor-like masses. It can metastasize and result in secondary cysts or larval growth in other organs. It can be confused with carcinoma or cirrhosis, which is liver disease. Transmission is from the ingestion of eggs passed from the feces of foxes, coyotes, dogs, cats that have fed on infected rodents. Fecally soiled dog hair can also be a vehicle for infection. Again, the incubation is 5 to 15 years. Period of communicability. Eggs are resistant and can be infective for 1 year. No person-to-person transmission has been documented. Reservoir. So the tapeworm can be found in foxes, wolves, coyotes, dogs, and cats. These eggs can be shed into an environment. Dogs and cats can be infected when hunting wild rodents. Confirmed case is signs and symptoms with antibodies detected or larvae from a tissue biopsy. Some important case management work we need to ask are the date and onset of symptoms, history to travel to endemic areas, the person's occupation, history of exposure to foxes, coyotes, dogs, wolves, cats, and their feces. They should be examined for tumors or cysts via X-ray or ultrasound. Prevention. We should educate high-risk occupations about the life cycle of the parasite. We should wear gloves when handling carcasses of hunted animals. Wild fruit should not be eaten, especially from the ground. All wild food should be thoroughly cooked. It's important to deworm cats and dogs to reduce the exposure to eggs in the environment. And hand hygiene should be followed when petting animals or handling their feces. And that concludes all vector-borne reportable diseases in Ontario.